This is Christina Fiore of MedPage Today, reporting from Scottsdale, Arizona at the Pediatric and Congenital Cardiovascular Disease meeting. Elective surgery for Tetralogy of Fallot can be done long before symptoms start in patients under 6 months of age. That's according to research presented here by Dr. Roxanne Kirsch of the Children's Hospital of Philadelphia.
I think that it is safe, it is efficacious, that the procedure should be performed. Patients should be electively referred prior to developing symptoms. Waiting for them to develop symptoms is not actually favorable. It doesn't alter their physiology, which is the key problem, is the underlying anatomy that needs a surgical repair.
There are few data on the use of the procedure in the youngest and asymptomatic patients. So Kirsch and colleagues conducted a chart review of 277 patients with the disease who'd had the procedure before age 6 months. And they found favorable results.
So we had good results, I feel. We had hospital mortality was 0, so no patients died prior to discharge from hospital. We had relatively low morbidity considering the patient population. We had about 11.6% complications overall in 277 patients that were repaired across those 14 years.
Yet Kirsch noted that the optimal age isn't clear.
I would recommend referring patients with known Tetralogy of Fallot prior to development of symptoms, somewhere between 2 and 6 months of age. I don't know that there's further literature yet that delineates exactly which month between 2 and 6 months is the perfect month, and there may not be a perfect month, but among that group you'll have good outcomes, no or low mortality and low morbidity, and you'll benefit your patient population into their future.
She also pointed out the need for future monitoring of these patients.
I think that across 14 years of retrospective chart review, you find out a lot of information about what your immediate patient outcomes are. I think that it's important for us to continue to study patients into the future. Pediatrics, it's always difficult because lots of their outcomes occur later on in life, 20 or 30 years later. There can be long-lasting implications for what we do for them now.
At the Pediatric and Congenital Cardiovascular Disease meeting in Scottsdale, Arizona, I'm Christina Fiore, MedPage Today.